A ministerial task force will be formed to deal with the Wuhan virus. Health Minister Gan Kim Yong announced this today. It will be co-chaired by National Development Minister Wong. Now, so far, Singapore has identified 10 suspect cases of the novel coronavirus. 7 of those have been ruled out, while 3 are still being tested. Cheryl Go with this report.
A task force involving different ministries has been set up to ensure that Singapore can respond effectively to the situation. Health Minister Gan Kim Yong and National Development Minister Wong shared the details at a media briefing. Although the Health Ministry says the virus is not in Singapore yet, it is possible for an imported case to occur.
This is an important step forward in preparation for the eventuality that in case one of the cases occur in Singapore. So I think going forward we will be briefing the task force and getting the task force ready so that we can mount a whole of government approach to tackle this issue.
The task force will have their first meeting on Thursday, and Mr. Wong says he will help to coordinate across the various government agencies.
There are different ministries involved, including mine, MND. There may be financial implications, and that's where MOF will have to step in. So the processes and the intergovernment mechanisms are in place. We have contingency plans all drawn up and ready. But there is a matter of coordinating, getting all the agencies to work together to mount a united, effective response, and also to ensure that we have coordinated responses with members of the public.
Testing of suspected cases have been expanded to include people with pneumonia and who have travelled to all of China.
The coronavirus situation is evolving quite rapidly. As we know, China has reported increasing number of cases, and the cases have also expanded beyond just Wuhan city to other parts of China. And both China and the World Health Organization have also reported and confirmed that it is possible for human-to-human transmission.
MOH says suspected cases are being tested twice, and so far to date, 7 have tested negative, while 3 are being tested. If the virus comes to Singapore, the Health Ministry will adopt 3 response measures, which are to isolate cases, conduct contact tracing, and quarantine close contacts of the confirmed case.
We have to be ready and prepared that we may get the possibility of imported cases. And when that happens, we have to do our very best to protect, contain it, and ensure that it doesn't spread within the community.
MOH has also issued a travel advisory to defer all non-essential travel to Wuhan, while those going to the rest of China should exercise caution and attention to personal hygiene.
Acting Prime Minister Heng says Singapore must be ready to mount an effective response if the Wuhan virus comes to the Republic's shores. In a Facebook post, Mr. Heng said that the Wuhan virus outbreak situation is evolving quickly and countries around the world need to work together to take precautionary measures.
Mr. Heng noted that although Singapore has not seen a confirmed case, Singaporeans must stay vigilant and be socially responsible by taking necessary precautions and avoiding non-essential travel to affected areas. Meanwhile, Changi Airport has rolled out temperature screening for all flights arriving from China as advised by the Health Ministry. Some 35 scanners were put up across all 4 terminals from noon today as part of stepped-up precautions taken by the travel industry. Gwyneth Teo with more.
Passengers on this flight from Hangzhou went through temperature scanning upon landing. The airport has been screening travellers from Wuhan since 3rd January and expanded this to all flights from China as the number of cases reported across the mainland rises by the day. The airport says there are some 430 flights from China every week. The Health Ministry says those with high temperatures will be evaluated by a doctor at the airport and sent to a hospital by a dedicated ambulance if needed.
Travellers coming off of flights from China will also be given a copy of this health advisory in both English and Mandarin. Now, issued by the Health Ministry, it asks travellers to visit a doctor soon if they experience fever and shortness of breath and were in Wuhan in the past 2 weeks. Now, we've also observed that many travellers have taken to wearing face masks in the transit area as a precaution.
As Chinese New Year approaches, travel from China will also rise. Data from the Singapore Tourism Board over the past decade shows travel from China surges during the month of the Chinese New Year. In anticipation, hotels in Singapore are also taking precautions to protect staff and guests. Royal Plaza on Scots says guests from China make up 15% during the Chinese New Year period, compared to 3% at other times of the year. Staff started compulsory temperature taking recently, with extra precautions for those returning from China. The hotel has also stocked 500 face masks.
And in case there is really a case of a virus in the hotel, we'll quarantine the room, we'll lock the room, and will not let anyone go back into the room to make sure it's not spreading. And the people who have been in contact with the guests or people will be sent to the doctor as well, to the hospital.
Millennium Hotels and Resorts, which includes Orchard Hotel in its portfolio, says guests and staff are required to declare their recent travel history and illnesses. Shangri-La Hotel's precautions include more frequent cleaning and sanitizing of its premises and enhancements in food procurement and handling. The hotel says staff are also reminded to practice good hygiene.
The Health Ministry says those who have travelled to China and have symptoms of pneumonia, including fever, coughing and breathing difficulties, will be isolated. All emergency departments in public hospitals have also been in outbreak response mode, and there is currently no vaccine available.